Welcome back, my dear friends, and now we are going to speak regarding the rectus sheath, like what will be the boundaries of rectus sheath and what will be the contents of rectus sheath. Now already in our previous topics I told you there are like three muscles which are coming from the lateral aspect, that is your external oblique muscle, another one will be the internal oblique muscle, another one will be the transversus abdominis muscle. And already I made the concept already in your minds, guys. All these three muscles will have their own respective aponeurosis which are coming in the center. And in the center, they are enclosing these two muscles here. One big muscle that you are able to appreciate there, it is the rectus abdominis muscle. And then one small muscle, if you are able to appreciate there, it is the pyramidalis muscle. So first you got to learn about these two muscles, their origin and their insertion. Now rectus abdominis muscle we can easily appreciate here. It is actually originating from the pubic tubercle and the pubic crest. It is actually originating from the pubic tubercle and the pubic crest. And it will be inserting here onto the 5th and then 6th and then 7th costal cartilage. So it's originating from the pubic tubercle and the pubic crest and then inserting onto the 5th, 6th and 7th costal cartilage. And that is the reason why we can easily understand, okay, it is originating from the pubic crest and all. So if this muscle will contract, I'm going to bend in the front. It's helping in flexion of the trunk. Flexion of the trunk, okay. Now what will be the problem here? If suppose, if this muscle, if it is contracting, there are chances that it might bend forward also. It can bend forward like a bow and a string, bow stringing action. That is the reason we'll call it as bow stringing action. Now, to prevent that bow stringing action, in the middle of this rectus abdominis muscle, you are able to find the tendinous intersections. There will be tendinous intersections in the middle. And because of these tendinous intersections only, this muscle is actually divided into those three packs on one side and similarly on the other side. So 6 packs or abs, rectus abdominis muscle. So I repeat for the last time, originating from the pubic tubercle and crest, and it will be inserting onto the 5th, 6th and 7th costal cartilage and helping in what? Helping in the flexion of trunk. Now similarly, what about the pyramidalis muscle? Even the pyramidalis muscle is also originating from there only. It is originating from the pubic symphysis. But look at that, it is going and getting inserted onto this white line in the middle, that shallow depression in the middle, that is linea alba. So originating from the pubic symphysis, inserting onto the linea alba. So when it contracts, it will be actually helping in tensor. It is actually like a tensor for linea alba. Perfect. So whatever, this is like some general information regarding these two muscles that you have to know. But coming back to our main important topic, that is rectus sheath. How is that rectus sheath forming exactly? How will be the boundaries of that? Now to understand the boundaries of this rectus sheath, we'll not be able to appreciate that from the anterior aspect. I need to take a section. So let us take a transverse section here, sir. Now once you take a transverse section at this level, at the lumbar region, or in the lumbar region, if you take a transverse section, the diagram will be something like this. And in this I can crystal clearly appreciate, okay, so this is the rectus abdominis muscle on one side, that is the rectus abdominis muscle on the other side. In the middle of this there will be linea alba. And from the lateral aspect you are able to appreciate external oblique and then internal oblique and transverse abdominis. And their aponeurosis are the one which will come here and they are going to form a sheath, and that sheath is nothing but rectus sheath. So rectus sheath is actually formed by the aponeurosis of external oblique, internal oblique and transversus abdominis. Crystal clear in this diagram. But right now our topic is about the rectus sheath. So let us just focus on to this one here. Let's just zoom this one. So if you zoom, the diagram will be something like this here. So I hope you have seen this diagram of rectus sheath a lot of times during your MBBS days, guys. So let's start now writing all the notes regarding the rectus sheath. So first of all, the formation of rectus sheath, remember it is formed by aponeurosis. A rectus sheath is formed by aponeurosis of external oblique, internal oblique and transversus abdominis. Then the next thing that you have to know here is about the arcuate line. Now where do you exactly have this arcuate line? Remember, it is present between umbilicus and pubic symphysis. Arcuate line is exactly found between the umbilicus and the pubic symphysis. Let me show you exactly where it is present in this diagram here. Now in this diagram, there will be umbilicus present over here and this will be the pubic symphysis here. Somewhere between that, you'll be able to find one imaginary line here referred to as arcuate line. That is arcuate line. Now guys, why suddenly in the middle of this I'm telling you about the arcuate line? Why? Because the arrangement of the rectus sheath will be different above the arcuate line, and the arrangement of the rectus sheath will be different below the arcuate line. So above the arcuate line, the arrangement is different. I mean to say the boundaries of rectus sheath will be different, and below the arcuate line also the boundaries will be a little bit arranged in a different manner. That's the reason why we need to take like two transverse section, one above the arcuate line and one below the arcuate line. So we have to take a transverse section above and below the arcuate line. Perfect. So now let us try to see here these two sections, and not only seeing guys, let us actually draw so that it becomes much more clear. So let us now learn the boundaries of rectus sheath in a crystal clear manner. First, make the platform ready. In the transverse section, this is rectus abdominis muscle on one side, and then there will be rectus abdominis muscle on the other side. In the middle, of course, linea alba. Then the three muscles which are coming from the lateral aspect will be the external oblique, internal oblique, and transversus abdominis muscle. Now first what we'll do is we'll try to understand the arrangement of these rectus sheath layers or the boundaries above the arcuate line. So first let us try to understand how will be the arrangement above arcuate line. Now what's happening above the arcuate line is external oblique aponeurosis will be going anteriorly. External oblique aponeurosis will be going anteriorly. Don't say it is going above, it is not like superior. We are actually taking the section in transverse section guys. It is going anteriorly. Transversus abdominis aponeurosis will be going posterior to rectus abdominis. Then what about the internal oblique? Internal oblique aponeurosis will be dividing into two lamina. And one of the lamina, the anterior one, will be going here anteriorly, and one of the lamina will be going posteriorly guys. That's the arrangement present above the arcuate line. So therefore, now we can answer very easily what will be the anterior boundary and the posterior boundary. Look at my diagram now. So above the arcuate line, what is going to form the anterior wall? What is forming the anterior wall? The anterior wall is formed by external oblique aponeurosis. Along with that external oblique aponeurosis, even the internal oblique aponeurosis, but not the entire internal oblique aponeurosis, only the anterior lamina of this one. Now similarly, what is forming the posterior wall here? Above the arcuate line, what is forming the posterior wall of rectus sheath? It is again formed by transversus abdominis aponeurosis along with internal oblique aponeurosis, but this time it is the posterior lamina. I hope it is crystal clear. When things make sense here, you don't have to mug up all these things here guys. Now once you are done above the arcuate line, now let us see below the arcuate line now. So let's try to understand the boundaries of rectus sheath below the arcuate line. And again the same thing, let us draw the diagram in transverse section, but first let's make the platform ready. Rectus abdominis muscle on one side and the rectus abdominis muscle on the other side. And this will be the external oblique and then internal oblique and transversus abdominis muscle. Now what is happening below the arcuate line? Below the arcuate line, all the three aponeuroses, I mean to say external oblique aponeurosis as well as the internal oblique aponeurosis and even the transversus abdominis aponeurosis will also be going in the front itself. That means they are all together going to form only the anterior wall. So below the arcuate line, what is going to form the anterior wall of rectus sheath? It is formed by external oblique aponeurosis, internal oblique aponeurosis and the transversus abdominis aponeurosis. Then obviously, then what is going to form the posterior wall? Remember, the posterior wall of a rectus sheath below the arcuate line, you don't have that one. It is actually deficient. So all the three aponeuroses are going in the front only, but whereas, yes, posterior wall, you don't have that one guys. There is a deficient, posterior wall is deficient here. That's the reason why if you see in this first diagram here, which I have shown you, if you observe in this first diagram here, which I have shown you, why is this arcuate line formed there? What is this arcuate line basically? Above the arcuate line, I told you, internal oblique aponeurosis dividing into two lamina, anterior and the posterior. Then you have external oblique going in the front, transversus abdominis going behind. So whatever whatever aponeurosis which is actually going behind posteriorly, which is going to form posterior wall, that is the lower boundary of that. That is the lower boundary of that. So whatever aponeurosis is going behind, that is the lower boundary of that. That itself is nothing but the arcuate line. Now why we are not able to see any aponeurosis below that one? Why? Because below the arcuate line, all the three aponeuroses, whether it is external oblique or internal oblique or transverse abdominis, all the three of them are going in the front only. They are going anteriorly. That is the reason why behind you are not able to find anything over there. It's deficient. Now again recall, few minutes back we have studied about all the layers of the anterior abdominal wall. All the layers of the anterior abdominal wall we have learned in order. So if it is external oblique, internal oblique and transverse abdominis, then what is the next layer that I will be appreciating here? I will be able to see here. That is transversalis fascia. Okay. Similarly, here also I will be able to appreciate which fascia here, guys. That is your transversalis fascia. But I want to put one thing in your mind. When we have seen what is the definition or how is the rectus sheath forming, like what is basically rectus sheath, what is the definition of that and how it is forming. Rectus sheath is formed only by the aponeurosis. We did not write there that rectus sheath is formed by aponeurosis as well as transversalis fascia. So I want all of you to have a clarity here that transversalis fascia layer is present over there, but it is not a part of your rectus sheath. Transversalis fascia is present over there, but it is not a part of your rectus sheath. Rectus sheath is just formed by the three aponeuroses. So there is a chance that examiner can confuse you over here with the two questions here. I'll just tell you, listen very carefully. Below arcuate line, if the question comes like what is the layer present just behind the rectus abdominis? This is the rectus abdominis muscle over here. And if the question is asked that what is the layer present just behind the rectus abdominis below arcuate line, answer should be transversalis fascia. Question number 2. But if they ask you in the exam that what is the posterior wall of rectus sheath below the arcuate line, then the answer it has to be deficient. Why? Because there is no aponeurosis over there. Yes, but that layer is present. It is not a part of your rectus sheath, sir. Hope it is very, very clear. Now, once you are done with the boundaries of rectus sheath in a crystal clear manner, the next thing that we need to learn is the contents. What will be the contents of rectus sheath? The good thing here is you already know the contents, guys. There will be two muscles here. And these two muscles, number one, they will be rectus abdominis muscle and another one will be the pyramidalis muscle. And already in the beginning of this topic, we have discussed in detail the origin of that and the insertion of that and what is the action of these two muscles. Then you also have like two vessels here. There will be superior epigastric artery and vein, superior epigastric artery and vein, and then you also have got inferior epigastric artery and vein. Try to recall from the thorax topic. Already I told you that there will be internal thoracic artery adjacent to the sternum. There will be internal thoracic artery and it will be terminating here. It will be ending and ending by dividing it to two branches. One will be superior epigastric, another one is musculophrenic. So superior epigastric artery is actually a branch coming from internal thoracic artery, whereas inferior epigastric artery it's a branch coming from the iliac artery, guys. Then what about the nerves? Which nerves do you have over here inside the rectus sheath? In the rectus sheath, remember, you'll be actually having the lower 6 thoracic nerves, lower 6 pairs of thoracic nerves. So what do you mean by this lower 6 thoracic nerves? It will be from T7 to T12. So T7 to T12 here. So you'll be actually having the lower 6 thoracic nerves which are coming here in the anterior abdominal wall rectus sheath, guys. They are the content of rectus sheath. In this, if you want to learn a little bit in more depth over here, guys, remember out of this T7 to T12, T7 to T11 will be actually the intercostal nerves. Will be the intercostal nerves, guys. T7 to T11 will be the intercostal nerves, whereas the T12 will be below the ribs. So that's the reason why it is your subcostal nerve. To be more specific and to be like more clear, T12 will be the subcostal nerve, whereas T7 to T11 will be the intercostal nerves. So they are actually supplying to the intercostal space. Along with that, they are also contributing to the anterior abdominal wall as a content of your rectus sheath. That's the reason why if you are able to connect the concept now, these nerves are not the typical intercostal nerves. Why? Because typical intercostal nerves are those nerves which will be supplying only to the intercostal space, and that is T3, T4, T5 and T6. So you can just recall from the thorax topic if you have gone through that videos. T7 and all the remaining nerves will not be typical. Why? Because they are not only supplying to the intercostal space along with the abdominal wall also. So that is all about the rectus sheath, the boundaries of that and contents of that in a crystal clear manner, guys. Now continuing with the concept, guys, after completing the anterior abdominal wall, if you are observing all the topics properly along with me in a sequential manner, I have just now completed only and only about the anterior abdominal wall. All the concepts till now, whatever we have learned, it's all about anterior abdominal wall. The inguinal ring, the deep inguinal ring and superficial inguinal ring, inguinal canal, and the applied aspect of that inguinal canal, inguinal hernia, Hasselbalch's triangle, rectus sheath, everything with respect to your anterior abdominal wall. Now, according to our planning, let us go towards the posterior abdominal wall right now. Now, in posterior abdominal wall, you actually have to learn about the thoracolumbar fascia. This is the place from where the questions are being asked. Now, let me try to clarify this concept in a very crystal clear manner, guys. Hardly few minutes of time, it will be done. So, thoracolumbar fascia, it will actually have 3 layers. In this diagram, you will be able to appreciate that there is one layer which will be coming from the anterior surface of transverse process. That is nothing but the lumbar vertebra, and there is the anterior surface of the transverse process, that is anterior layer or anterior lamina. And then there is a middle layer which is coming from the tip of the transverse process here. And then there will be a posterior layer will be coming from the tip of the spinous process here. So these are the 3 layers of the thoracolumbar fascia. So there will be anterior layer, there will be a middle layer and there will be a posterior layer. There will be 3 layers of thoracolumbar fascia. And if once you are comfortable with these 3 layers, in between them you will be able to appreciate like 2 muscles here. And this muscle present between the anterior layer and the middle layer is actually the quadratus lumborum muscle. And then this muscle present behind will be the erector spinae muscle, that is the true back muscle, erector spinae muscle between the middle layer and the posterior layer of thoracolumbar fascia. Now, if that is quadratus lumborum muscle and erector spinae, if you are comfortable with those two, then sir, where is psoas major muscle that will be usually appreciating in even the radiological images and all those things? Psoas major, yes, you can appreciate that outside here. So this is the psoas major muscle present separately over here. So that is the main important thing which I want you all to understand in the thoracolumbar fascia. And remember, let us try to make a diagram for this one here. So imagine this one to be the lumbar vertebra, the vertebral body, and then this one here will be the transverse process and the spinous process. There is one layer of thoracolumbar fascia from the anterior surface of the transverse process, and there is one more layer, the middle layer, coming from the tip of the transverse process, and then finally there will be one more posterior layer coming from the tip of the spinous process. And between these 3 layers you will be able to appreciate there is a muscle present over here, and this muscle is present between the anterior layer and the middle layer of thoracolumbar fascia, and this muscle is actually referred to as your quadratus lumborum muscle. So quadratus lumborum muscle is between the anterior layer and the middle layer of thoracolumbar fascia. Then there is one more muscle present over here between the middle layer and the posterior layer of thoracolumbar fascia, and this muscle is actually the true back muscle, which is known as the erector spinae muscle. Erector spinae muscle. Then again the same thing, where do you have the psoas major? Psoas major muscle you will be able to appreciate over here. So this will be the psoas major muscle, and it is also covered by a fascia, that is psoas major fascia itself. That is your psoas major muscle. Now mainly concentrating on the thoracolumbar fascia, what else? What else do you have to remember? Apart from the 3 layers and muscles enclosed inside that, you also have to remember it is the one which will be actually giving origin to the muscles over here on the lateral side. Now which muscles do we have towards the lateral side over here in the anterior abdominal wall, which are even coming in the anterior abdominal wall? External oblique, internal oblique and transverse abdominis. Now out of those 3 muscles, remember the internal oblique muscle, this one, and inside that the transversus abdominis muscle. These two are the one which are originating from thoracolumbar fascia. So internal oblique and transversus abdominis will originate from thoracolumbar fascia. So these are all the points that you have to remember. Thoracolumbar fascia will be actually having 3 layers, and you have to remember the muscles which are enclosed between that 3 layers and the muscles originating from there, and the positioning of the psoas major muscle with respect to all this. That is about the posterior abdominal wall along with the thoracolumbar fascia, guys. Now once you are done with this one, we are actually done with the anterior abdominal wall and posterior abdominal wall and all the concepts related to that one. According to our planning, after completing the abdominal wall, let's go inside. Let's learn about the viscera, and along with the most important thing, that is the blood supply. All the blood vessels and their branches, it's extremely important. We'll learn about that. Thank you.